Dr. Zabella with Florida Fertility Institute. Today we're going to show a video of an IVF retrieval. The room is being scanned so that you could see what equipment is in the room before the patient's brought in the room. Once the procedure is started, you'll note that an anesthesiologist is at the head of the table where he's monitoring the patient and providing IV anesthesia. At this point, I am putting on sterile gloves. The IVF retrieval is an aseptic procedure. You'll note that initially we'll clean the vagina and the cervix with some sterile saline. And after that's done, the vaginal ultrasound probe is placed. This is the vaginal ultrasound probe that we'll be placing inside the vagina and attach the needle guide and the aspirating needle for the IVF retrieval. I'm looking at the ultrasound machine's screen to visualize the follicles. A needle is then placed through the ultrasound probe into the back of the vagina and directly inside the follicle. And in this picture you could see that Andrea, our IVF coordinator, is holding the tube from the needle that goes into a test tube. And fluid is slowly filling the test tube. It's reddish pink. Once the test tube is filled, then she removes it from the tubing and places it in a warmer in the pass-through between the retrieval room and the embryology laboratory. And this procedure is continued until all follicles which have eggs have been aspirated. After the eggs have been aspirated and passed through to the embryologist, we observe the patient as she slowly wakes up. This usually takes approximately 10 minutes. Following the procedure, she can perform normal tasks, and we typically observe their vital signs for approximately 30 minutes before they're discharged. Typically, there's minimum discomfort, and usually Advil or Tylenol is all that's required upon discharge. The next day, we will call the patient and let her know how many of her eggs are fertilized, and typically schedule an embryo transfer 3 days after the retrieval.